Good morning friend. Today we are going to discuss about the chapter number 4. Chapter number 4. Chapter number 4, Posology. Posology. Definition of posology is a branch of medical science which deals with dose quantity of drug which can be administered to the patient to get desired pharmacological action is called as a posology. Get desired pharmacological action. Posology term is derived from Greek word that is posos meaning how much and logos meaning science. ठीक है. There is posos means how much and logos means science. How much dose required to show its pharmacological action. In simple term, posology is a science of dose. ठीक है. समझ लो मग there is science of dose. You have to study in the dose calculation is called as a posology or so dose calculation जे study जी आहे त्याला म्हणतात posology. Factor affecting posology. There is various factors near about 15 factors which affect the dose. You require to decrease or increase the dose of your patient depending upon the severity, depending upon the condition of the patient. So we are considering the main 15 factors which are the responsible for or affecting the dose for the dose calculation. The first factor is age. Age is most common factor influence the amount of drug to be taken, to be given. Infant require much lesser dose. Infant means less than 1 year child that require the very less dose because that has a very high water body content. Children under 12 years require fraction of dose, whereas children below the 12 years require the fraction of dose. आता जे चिल्ड्रन्स आणि इन्फंट आहे त्यांना डोस कमी लागतो ॲज कम्पेअर टू युअर adult dose. Whereas 18 to 16 year elderly patient require more dose. Whereas 18 to 16 year elderly patient require more dose as compared to your smaller dose, depending upon the action of drug and condition of the patient. Then newborn is just newly born patient. His infant has high body water. It containing the high body water, low immature renal and hepatic function. Thus renal and hepatic function म्हणजे काय? There is renal, kidney function and hepatic means liver function. That is the immature असतं त्यामुळे त्यांना डोज कमी लागतो. The drug doses of the newborn low. Because gastric acid secretion is also not adequate. There is GIT secretion in stomach. There is not adequate. Because of this reason, there is low dose is also required. For example, in GIT, gastrointestinal tract, absorption of ampicillin and amoxicillin is greater. In neonate due to the decrease in gastric acidity. There is ampicillin and amoxicillin absorption is greater. Children. The tissue of infant and child are highly sensitive to the large number of dose. Whereas children and infant are highly sensitive to the large number of dose. Children and they are very sensitive to the large dose of dose. Thus require fewer dose. That's why it requires a fewer dose. Children below 12 require the fraction of adult dose because drugs metabolize enzyme system is insufficient. The blood-brain barrier is not fully developed, thus more sensitive to CNS stimulant. आता चिल्ड्रन्स आहेत त्यांच्यामध्ये काय असतं की बाबा एन्झाईम सिस्टीम डेव्हलप नसतात. दॅट्स वाय वी रिक्वायर द स्मॉलर डोज. मेटाबॉलिझम मीन्स to the drug is get converted into one form to another, metabolized by the enzymes. It can be get converted one form to another. That not be metabolized by the enzyme. That's why the dose is less. आता blood brain barrier not fully developed. There is blood barrier between the blood and brain. That's why it not fully developed. So more sensitive to the CNS stimulant. Central nervous system acting drug जे आहेत ते more sensitive असतील because of they are cross the blood brain barrier. If the blood brain barrier cross the brain activity, CNS related stimulant will be activated. Adult. The average adult dose for the individual for medium build with age 18 to 16 years and weight is 70 kg. आता adult कोण आहे 18 to 16 year of age आणि ज्यांचं वेट आहे 70 kg त्यांना म्हणतात अडल्ट. The every thin and obese individual, the dose may be modified using either the body surface area, body weight, body surface area in found from the formula, height and weight and average about 1.7 to 1.8 meter square. Whereas thin patient जर असेल तर डोज कमी लागतो, obese जर पेशंट असेल तर डोज जास्त लागतो. That will be the calculated by according to the weight or height. According to the weight or height, that should be calculated with according to the weight or height. In geriatric patient, our age group is more than 16 years. Of this patient require special consideration. आता patient group जो आहे more than 60 years of age, patient requires special consideration because physiological changes occur with age such that reduction body weight, reduction body fat, reduction intestinal mobility, blood flow, gastric. Geriatric patient, aging and renal hepatic dysfunction issue result in require fewer dose. The geriatric patient मध्ये काय किडनी कॉम्प्रोमाइज असते, हिपॅटिक इम्बॅलन्स असतं, त्याच्यानंतर फिजिओलॉजिकल चेंजेस विथ एज सच ॲज बॉडी वेट, रिड्यूस इन बॉडी फॅट आणि इंटेस्टाइनल मोबिलिटी असते. देयर इज रिडक्शन इन इंटेस्टाइनल मोबिलिटी लीड्स टू द रिक्वायर द लेसर डोज. Sex. Now we are how to sex is affect. Sex particularly important in the case of treatment with sex hormone. Sex patient is required to say female adult generally require smaller dose as compared to your male. The male due to presence of more body fat viscera. Why more male require more? Because of that have the more body fat in present. There are body fat level जास्त असतात. Suppose to be we are take an example. Testosterone increase the rate of biotransformation of drug. Drug used to ulcer may causes the increase in the bleeding. Testosterone increase the rate of biotransformation of drug. Biotransformation means change in chemical change of drug. There is testosterone responsible for increase the change in chemical nature of the drug. Also responsible increase the change in chemical reaction of drug. Drug used in ulcer may cause the increase in bleeding. Other drugs may be used in the ulcer patient, ulcer female, increases the bleeding. During pregnancy, what happen during pregnancy? In pregnancy, cardiac output, glomerular filtration rate, renal elimination of drug, volume of distribution, metabolic rate of some drug are to be taken consideration. आता प्रेग्नन्सी मध्ये काय होतं? देयर इज प्रेग्नन्सी, कार्डियक आउटपुट, ग्लोमेरुलर फिल्ट्रेशन रेट, रिनल इलिमिनेशन, ड्रग वॉल्यूम ऑफ डिस्ट्रीब्यूशन, मेटाबॉलिझम रेट शुड बी आर टेकन इन कन्सिडरेशन. ठीक आहे. लिपोफिलिक ड्रग क्रॉस द प्लॅसेंटल बॅरियर अँड स्लोली एक्झर्टेड. आता लिपोफिलिक ड्रग असतात, लिपिड लविंग ड्रग जे असतात, ते इझिली कॅन क्रॉस द प्लॅसेंटल बॅरियर. दॅट्स वाय द इट अफेक्ट ऑन युअर चाइल्ड. Especially during the first trimester of drug should be given unless absolute necessary. In first trimester मला तुम्ही drug देऊ नका because of it has a harm to the child or there is cause of abortion. This is factor should be in consideration of calculating the dose. Weight. Then fourth, weight of patient has more direction bearing one dose than any factor. The dose is given per body weight. The dose is should weight of patient has more direction bearing one dose than any factor. The dose is given per body weight. Average muscular weight between 15 to 100 mg, 15 to 100 kg. Being the average, the usually doses for drug are mentioned generally for the 70 kg. Generally, we are considering the average weight is 70 kg, whereas between 15 to 100 kg there is weight. You have to take a consideration for the calculation of adult dose. Severity of disease. If severity is more, we require more drug, whereas severity is less, you require a less dose. That is called as a severity of disease. In common expression, that dull headache may be relieved the single tablet of aspirin, when severe headache may necessitate administration of 2-3 tablets, same drug, but it is not true in all cases. Whereas severe headache we require 2 or 3 tablets, whereas in ठीक है, this is the 5 factor. Remaining we will see tomorrow. Thank you.